I am joined today by Dr. Kim Kline. Dr. Kim Kline, please introduce yourself.
As Ryan said, my name is Kim Kline. I have a PhD from the University of Georgia, which is where I studied health communication. I've been here at UTSA since 2007. And my area of research, I think that's what I'm supposed to talk about here, is health communication. But in particular, I take kind of two different tracks. One, I look at popular media, so I get to watch a lot of TV and movies and read newspapers and that type of thing. And the other is in health campaigns, basically trying to promote healthy lifestyles and behaviors. That's kind of that in a nutshell.
What are some of the biggest challenges you see as you evaluate or critique or digest that media that you like to watch to help inform your students about health communication?
One of the biggest challenges is that the research that I do is generally qualitative. And so that is in health communication, most of the research, at least when I first started out, was quantitative. It was social scientific, looking at attitudes, beliefs, and behaviors and that type of thing. And so that was a big challenge to get into that. And then I added another part that I didn't mention is that I'm also a critical cultural. So I challenge, the hegemony and the power dynamics and all of that kind of stuff. And that also made it difficult.
Dr. Kline, you study so many different aspects of health communication. Do you see any places where we have convergence in the different fields and different topics that you study?
I do actually. About in 2007, actually, right as I was joining the faculty here at UTSA, I also started working with some public health faculty at Baylor College of Medicine. And they brought me in because they were trying to promote healthy behaviors, wellness for Hispanic individuals who were suffering from diabetes. And what they wanted to do was create a telenovela, an interactive telenovela. And they said, hey, Dr. Kline, you really know about entertainment education, and you know about media and movies and that kind of representation. You think you could come in and help us with this? And I said, I think I can. And so I started working with them, and we did. We developed, and I wish I could show you the link to it, but it was made with a different kind of software that we no longer have, and they have to get it converted. But it was called Sugar, Heart, and Life, and it basically had this family, and the husband, the father, had been recently diagnosed with diabetes, and it was talking about the challenges that they faced in terms of diet and exercise. And the cool thing in this project was that you would be able to choose what he did, right? And so he could make a bad choice and it would lead him down this track, or he would make a good choice and it would lead him down this other track. And then at the end, you could see how it all worked out. So, that was bringing in my understanding of media and film and, that kind of representation. And then the very cool thing is that I've been working with them since then, and we've worked on a number of other little videos, right? And I think, especially at UTSA where we're focusing on digital communication, that would be a kind of career path, that you would go into public health and you would create these kind of videos. And most recently, I've been working with them. They're doing theater productions to try to promote breast, cervical, and colon cancer early detection screening. And so again, because of my expertise in entertainment media and in combination with my understanding of theory in terms of health promotion, they brought me in on that one too. And so I think we just finished up a paper last night. I'm very excited about that.
That is super exciting. And what a fascinating project. What are some of the keys and tools of influence in this kind of health campaign? Persuading anybody to make healthier choices is an uphill battle. So what are some of the things that you keep in mind as you construct these kinds of health campaigns that blend media and influence?
And I would say there are two aspects that are really important. One is an understanding of narrative and the idea of, who the actors are and what's going to engage the audience. Identification with the character. Identification is a key term, right? It's a theory term. And so those ideas and how we can get the audience to, not see this as just an advertisement or a persuasive message, but can get engaged. We call it transported into the narrative would be what we try to do. But the other part is trying to be culturally aware. And that is a fairly new thing in our discipline. And I say fairly new, within my tenure as a professor. We had just gotten started really looking at culture back in, when did I graduate? 1995, 96. And so I kind of came in at a really good time. And the idea that not everybody is the same and cultural differences are going to we're going to understand things differently based on our cultural experiences. Now, when I first started out, I would have talked about cultural sensitivity, and to some extent, that's part of it. Just being aware and adapting to your audience. High public speaking. See, that came back. But it's also my critical perspective now, which I developed over a period of years, is not necessarily trying to use what I know just to persuade, but really trying to adapt my expectations to to meet the audience's needs, to meet those individuals' needs. Collins talked about Penn 3 model. I don't know if these matter to you or not, but what they're really both saying is, instead of being a top down, we're going to tell you what to do, it's a bottom up. You're going to let us know how we can help. And so trying to do that, I think that that's really important to keep in mind.
It involves more research and more listening and more audience, paying attention to your audience in ways that maybe other kinds of campaigns don't, or feel like they don't have to. And really they should. They should be asking what you want and then fulfilling that need, as opposed to here's what you should buy, right? So it's not really so much getting people to buy this idea of taking care of yourself or taking care of loved ones with these kinds of health issues. It's saying, what can we provide for you to help them overcome those issues in their own lives, and where can we meet you? What are some of the tricks or tips for meeting people where they are? Is it just deep listening, or is there more to it?
Listening is an active, most people kind of confuse listening with hearing. Hearing is a passive thing, it just hits your eardrums, and listening is actively processing and thinking about how I can adapt to you as well. And it is a hard thing to do because, at the end of the day, when it comes to health promotion, we have this thing that we think is good for you to do. And so basically trying to go, well, let's figure out if we want to help you do this thing, how it would work for you. I get really frustrated with this kind of assumption that just because it's good for you, if you don't do it, then you're a problem, right? Then it's your fault. And we do a lot of that in health. It's victim blaming. And I know in the discipline, though, most of my colleagues are trying to move away from that, trying really hard to not fall into that. If you've gained weight, it's your fault because you didn't go on a diet. We told you how to do that. But also thinking about how can I help this person be healthier, even if they don't do exactly what I want them to do? So I don't know. Again, I'll go back to one of the things that I learned from Collins Ariamboa with the Penn 3 model is that the real emphasis should be on empowerment, right? How can we empower individuals to find their most healthy life? And I think that sometimes means giving up on the perfect healthy life that public health officials would want us to see, but finding what is best for the people.
I love that, and doing what works, right? Like helping people do what works for them personally. What are some of the challenges and barriers there to forming those messages, to meeting people where they are? It seems like a really difficult task, especially, in my experience, changing my behavior, even if I really, really want to, is difficult. So what are some of the things that you're able to do to start that campaign where you're blending the media and different tools to help people get healthier?
I would say one of the biggest challenges is being able to recognize that not everybody is going to do exactly what I tell them to do. And I, people will tell you I'm a pretty bossy person, I'm pretty opinionated. And I actually, you know this, you've been around me for 15 years. You've seen me in meetings, you know that I have an opinion and I'm very assertive and I try to get you to do what I want you to do. But over the years, I've been trying to figure out a way to meet in the middle I guess would be a better way, and recognize that my way or the highway is not necessarily the best strategy. And I think that goes, I just was talking about this in class yesterday. So I teach intro to health communication. And we're on our second to last day yesterday with this group of students that really great, just really, really love this class. And so we're talking about health campaigns and, acknowledging that all of us have things that we know we should be doing, every one of us, right? But that we don't, and to try to kind of engage in some self-reflection about why that is. And again, let me give you a theory term, self-efficacy. Our biggest problem is not believing that we can or finding reasons. So like if I were going to talk about, like back in the day when I used to smoke cigarettes, and, why couldn't I quit? Well, I'm busy and I'm, doing my PhD and I'm, I just don't have time. And then you're like, if somebody can help me go, okay, I am aware that those are challenges. So let me help you figure out how to overcome those challenges. And it's one of the things that if you start looking at health campaigns, when people are trying to persuade you to do something healthy, look at them real close. And I'll bet you'll see that the ones that are least persuasive are the ones that don't tell you how to overcome your own personal barriers to doing the thing, right? And understanding who you are. We talked about the one, you remember the Just Say No campaign with drugs? Just say no. This is your brain. This is your brain on drugs, and I'm like, if it was that easy, right? Remember back then the argument was, well, if your friends are trying to get you to do drugs, then they're not your friends. And I'm like, see, you don't understand your audience. You don't understand your audience because they're 12-year-old kids. They are to their friends. You need to figure out a way to help them say no, when they're feeling like they're going to lose their friends.
I love that you mentioned that health campaign because it's one of the most popular of all time and a great reference point for how health campaigns can go wrong, right? Because that whole idea of just say no spoke to some people, and it did work for some people, but for so many people, we hear stories of that campaign actually leading to more people wanting to do the thing they didn't want them to do, which is scary. Can you think of other examples like that where a health campaign backfires?
Do you remember I think it was a Saturday Night Live where they were like doing a spoof on that one. It was, this is your brain on drugs. It's like, dang, that's making me hungry. Like I really want to go to IHOP now or something like that. It was not very effective. One, I can tell you one that became more effective, right? If you remember back in the day when we were trying to get kids to not smoke cigarettes, what would be the big threat? The threat is, well, if you smoke cigarettes, you'll die. 12-year-old, 13, 14-year-olds, they're not worried about that. They're not thinking about that. So then they started to come out with a lot of the campaigns that focused on peer pressure and what your friends thought about you. And I think one of the first ones that I can remember was Brooke Shields, and she had the cigarettes in her nose and they were hanging out of her nose, and just kind of like, you look stupid when you're smoking. Or, the one where they just basically they lose friends. And that was a good example of really paying attention to the audience and understanding what matters to them. 13-year-olds aren't worried about dying. They are worried about their friends.
And the Truth campaign too, right? That Truth campaign that came after, where the cigarette companies were funding that health campaign to get people to stop smoking. Did you look at the Truth campaign at all? Was that effective or ineffective?
Well, I haven't looked at it a whole lot, but here's the thing a little bit. What's really interesting is one of the reasons I should say, why it was so effective, why the kids really loved the Truth campaign was because they were railing against the machine, right? I mean, again, understanding that at that age, they're challenging, these authority figures. And so it was very brilliantly done, right? This idea, I'm going to get you on board to get mad at the man.
I know media studies is something that really is so much fun to talk about. I love hearing you talk about it. Where can media studies kind of intersect with this idea of creating more effective health campaigns?
Well, if you think about it, in all of the shows, and obviously we can talk about the health shows like Grey's Anatomy and New Amsterdam and House, which well, say he bugs me. But any of those shows, the medical shows, and by the way, I watch them all, Chicago Med, all of them. But then there's also any other show wherever they talk about some kind of health issue. And the best ones, the easiest ones to think about for people who aren't attuned to watching it are the specials, where you know that they're purposely trying to teach you a lesson. And then at the end, they'll go, if you know of anybody who has suffered post traumatic stress syndrome, here's a number that you can call. Or if you know of anybody, right? And so they give those numbers. But there are people. There's actually an organization, or it's a group called Health Hollywood and Society, and you can Google them. And they actually work with directors and TV producers to try to get them to give the best information that they can. It doesn't always work, because at the end of the day, TV shows and that kind of thing, they want to be dramatic. So there was some research done led by, I want to say, Susan Morgan, about organ donation on TV shows. And her and her team were looking at the fact that a lot of shows have that trope, right? The black market organs in the United States. And she's like, that doesn't exist. But the problem is when they promote that on TV and on these shows, when they keep showing that, it makes people scared to mark on their driver's license that they want to be an organ donor, right? And so she and her team keep fighting on that. That's a specific instance of really trying to change the narrative as much as they can. So it can help understand. I mean, at the end of the day, Ryan, the reason why I study media, other than because it's fun, is because I believe that that's how people come to their understandings in large part, right? I mean, we learn from our parents, we learn from, if we go to church, we learn from our friends. But a lot of what we learn about health and illness and wellness comes from watching these kind of TV shows and movies and advertisements and news and that type of thing in unintended ways, right? You don't realize that you're learning, I'll give you an example that I use in class. I talk a lot about, because I do women's health, we talk a lot about condoms. And if you think about the message that gets presented on TV shows, including, shows like House, and I talk about this in a book chapter somewhere, Private Practice and Grey's Anatomy. Condoms don't work according to TV. They don't work, right? I mean, here's the thing. Watch a medical show. They're nurses and they're doctors. In private practice, they were like running a women's health clinic, and one of the physicians gets pregnant and doesn't know who the father is. So she's having sex with two men, not using a condom, right? And so there's that message that's coming across that condoms don't work. And you don't even realize you're getting that. So that's an example.
That is a really great example because, like you look at the effectiveness of a drug or an intervention like condoms, and that effectiveness is proven over here, but in our actual narrative, in our culture, it's the opposite. So can you think of other examples where your job as someone who's helping with places like Baylor on these health campaigns is made more difficult by popular tropes or popular drama creating devices like those we see on TV? Because they want the drama, because they want the attention, because attention is money, right? So what are some of those things that often get in your way as someone who is helping people in this way?
I wouldn't say necessarily that it gets in my way. What I would say is that whenever we're doing any kind of health campaign, you can look at most of the theories will say that we really need to understand what are barriers to self-efficacy. And, some of that can be cultural, some of it can come from family and tradition and that type of thing, but also can come from, well, I would say TV is culture, right? That is, popular culture. And so it's not so much that it's a challenge or a barrier or whatever, but it is that, being aware of what the message is and knowing that you're going to have to fight that, right? So if I was going to do a campaign promoting safer sex, then I would have to be aware that all of these TV shows are basically running counter to what I want to tell, these young people, and then address it, right? Just go, I know that that's happening because it's often the case that they don't even really know why it is that, you know, they don't want to use something or don't want to do something, right? To be able to articulate that is going to be kind of challenging.
I'm thinking about like the vaccine campaigns and the misinformation that was, sent around that. Can you speak a little bit to that and how people working in public health campaigns overcame it?
Vaccine campaigns are really hard. Another one that I worked on was not like the COVID vaccine, but part of my research is on the HPV vaccine. And starting back in when it first came out, I remember the first time I heard about the HPV vaccine. I didn't hear about the vaccine itself. I was working at SIU, and I was sitting out on this outside, and this kid came up and he was saying, oh, they found a cure for cervical cancer. And I'm like, no, they didn't. I don't know what you're talking about, but no, they didn't. And so then I had to go do some research, found out it was the HPV vaccine, which actually is, I'm a big fan of it. I think, young people should get it. So I want to clarify, but the marketing for that at the very beginning focused on cervical cancer. And because of that, it focused on the fact that it was sexually transmitted. And because of that, we had lots of parents who were like, I'm not giving my kid a vaccine, because for sex, she's only 12, and they only made it about girls. And I'm like, okay, all right, a couple of things here. First of all, we're not promoting sex. It's not going to promote sex. Second, it's for both boys and girls. If we're going to get herd immunity from this, we need to have both boys and girls get it. Nowadays, you may not even realize that, Ryan, because now it is marketed to both boys and girls. But back at the beginning, it was only for girls. So you brought up the misinformation, and I think that the same thing that was happening with the HPV vaccine came up with the COVID vaccine. You have these people fighting, and the MMRs, right? We are always fighting that when it comes to vaccine. People putting the false information.
You said MMRs. What was that?
Measles, mumps, and rubella, MMRs. There was, so pretty much from the beginning of vaccines, and I actually did some research on the history of this. There have been people that have fought against it. So there was one, I think it was, I want to say it was the MMR. You might have to fact check me on that one, but it was one of those that the young kids were having to get right before they went to school. So there was a study that was done, presumably showing that it caused autism. We found out later that study was bogus. It was nothing right about that. And actually, I think they had to pull it from publication. But it every once in a while, you'll see this come back around on Facebook. Oh my God, it'll cause these problems. Same thing with HPV. There was a whole lot that it was going to cause all of these problems, and you see it come up, and you're like, the evidence would not suggest that that's the case. Same thing happened with the COVID vaccine. There was one that showed that it caused people to turn into zombies. I've got a video of that. And it was actually the clip that they were using was from a completely different study on gun violence. So, the only way to fight that, Ryan, is just to keep speaking, from a scientific perspective, keep trying to show the science of it. I don't know any other way.
I wonder how you talk to people in health campaigns that are scared like that. Like they believe the misinformation. They believe these horrible stories that have been spread around. How do you crack into that shell of fear and help them move towards making choices that will benefit their health?
You remember when I said sometimes you have to just accept that you can't get everybody? Sometimes you just have to accept. I have worked really hard. Again, you know me, I'm terribly opinionated, and it used to be the case that I would argue until you wouldn't argue with me anymore. I just like beat it in. And I've since changed that, where if you are telling, and I have friends who refuse to get the COVID vaccine, and I'm not going to argue with them. I will tell them as much as I can, and then I will let it go, right? Because you know, different people have to make different choices. At the end of the day, you're making choices, for yourself, and I'm not going to judge. But I am going to try to reach other people. So, if you think about like an audience polarity, there are some people that are more likely if they're right on that tipping point, maybe I can, get them to cross over, or maybe I can just get them to move to accept a little bit more. You know what I mean?
Absolutely.
Yeah, that's where I'm at in the world right now. Just trying to, live and let live, and try to help people see that there are options, but not try to blame them if they don't want to do what I say.
Can you think of some success stories, some stories where a health campaign was so well constructed that it actually worked, that it actually got the results?
Yeah, I mean, like health campaign. Here's the thing: health campaigns do work. You think about the one that you just said, the just say no. That was back when we were just starting to learn about health campaigns, right? So, to say that it didn't work, that's a fair statement. But also, we need to understand that they hadn't done the research. They didn't have health communication is really a fairly new discipline. um, I got kind of lucky coming in when it was really starting to take off. And so, I don't want to. I want to be careful about blaming them for that. Like what campaign? Then we just mentioned one that I thought was pretty successful. Oh, the campaigns about reducing smoking, right? That were focusing on peer pressure and that type of thing. And I'd have to go back and look to remember the exact campaigns, but they all had that in common, trying to focus on that. And we've seen the rates of smoking go down pretty dramatically. You know, I'm always surprised now when I ask students, how many of them smoke cigarettes, and very few of them do. And I know that not all of them are going to raise their hand when I ask them that question. But it typically comes after we've established a little bit of rapport, and so I feel like I have a pretty good sense that most of my students are not smoking.
And we just saw Juul settle that huge settlement, right? So for vaping, which has replaced some of those bad effects of smoking too. Can you speak a little bit to how Juul got away with marketing to kids and now had to pay a fine? But is that fine even a fraction of what they made in marketing their product to kids?
No, probably not. And the thing about vaping, it's a really that one is a difficult challenging. You were talking about challenging topics because here's the thing: vaping is really problematic for young people. It's very probably they start vaping, and the part of the reason why it's problematic for the young people is they start with something like Juul, which has so if you look at the range of vaping products, there's the e-cigarettes, and those have less nicotine. The juice that you put in them have less nicotine. Juul had like 30 times the nicotine or some ridiculous amount. And so what would happen is the kids would be vaping on the Juuls, and they would very quickly become addicted to the nicotine. And then it was a gateway to smoking cigarettes. Whereas for older people who were already smoking cigarettes, vaping was a way to quit smoking analog cigarettes and to do something that was healthier than smoking cigarettes, right? It's a nicotine way of getting nicotine. So it's a challenging question, because it's not as simple as cigarettes. Cigarettes are bad for everybody, no matter what. I don't care what you say. Nobody should be smoking cigarettes. Vaping is much more complex of a situation.
How do we know a campaign has worked? And do you have any examples of campaigns that you've worked on that can serve as success stories?
So when we're talking about measuring the success of a campaign, one of the things that we have to realize is, obviously we really want them to change their behavior. That is the gold standard, is to get them to do the thing that we want them to do. But it's also the case that there's a range of considerations. We may need to get them to be aware that this is something that they could be doing, or we need to get them to accept that they should be doing it, right? And then we can get them to change their behavior. And so when you're asking about measuring success of campaigns, we have to look at all of those things. And here's another thing that we also look at is whether, from a communication standpoint, whether they even liked the campaign, right? So I have one study working with the folks that I work with at Baylor, Baylor College of Medicine, and they're the Office of Outreach and Health Disparities there at the Dan L. Duncan Comprehensive Cancer Center. I've worked with them a number of times. And one of the studies that we were looking at was with the telenovela that I told you about earlier. Did the people watching it, did they identify with the characters? Did they feel transported? Did they, identify with the situations that these characters were experiencing? Right. So in that particular study, we were looking at did they actually change their behaviors with regard to diabetes. We first wanted to know if we were just successful at getting their attention, right? On the other hand, with some of the stuff that we've done with the HPV vaccine, we have done studies and demonstrated that the rates of HPV vaccination in Houston, in that area, because that's where they are, that they've gone up, and that we're improving the actual getting people to get their vaccinations. So it's not just one thing that you're measuring. And keep in mind, campaigns go over a period of years, right? I mentioned I've been working with the Baylor representatives. I've been working with them since 2007 and trying to do these campaigns. Campaigns go over a long period of time, right? So you have to kind of measure different things at different points.
Over those years, have you seen changes in how you approach this idea of awareness, acceptance, and change?
I would say yes. Part of the reason why I've seen the change is because we've started to take this more critical cultural perspective, right? And I mentioned a couple of scholars, but here at UTSA, Shamshad Khan, who is a critical cultural health communications scholar, and others that I've worked with, this idea that what we're looking for, we want to be very careful about only talking about behavior change, that we need to think in terms of the way that people are thinking about things, and how culture is going to impact them, and how this will impact their lives within their daily lived experiences. So that's been a huge change, because when I first started, we were very social scientific, quantitative. Behavior change was the main variable, whereas now it's just really expanded. And we've also seen a change in along with that, in terms of paying attention to culture, that we're talking about gender, we're talking about sexuality, we're talking about race and ethnicity, we're talking about religion, we're talking, all of these things and how they come into play. Here's a term for you: intersectionality is a big issue, and that's fairly new in the big scheme of things, and definitely has changed the way we are thinking about health campaigns.
I'd love to hear more about how intersectionality has impacted how you measure success. Do you look at all those different variables you mentioned, or are there some that you elevate above others to really get at the nuance? Because this seems like a really hard thing to measure.
Oh gosh, it is a hard thing to measure, and I don't know that I could point you to any of my own studies that have measured in that way. It is mostly that we attend to it. We realize that, we need to be careful about limiting to the old, it's just male or female, and the five race categories, and that type of thing, that we need to be careful about doing that. And how, again, so intersectionality is one of those, you can't just separate being a woman and being, a particular race, and being, LGBT, whatever, that those all, interact and have an effect. And so you don't want to actually necessarily separate them in that kind of quantitative way. It's a challenge.
So your qualitative research is asking for those inputs instead then. And in your qualitative research, you're asking questions with frames. How are you careful not to influence the answers in those framed questions?
All right. Well, so here's a good thing, Ryan. I don't actually do my qualitative research is generally textual analytic, so I can't influence it. I can, however, influence the interpretation, right? But the way I deal with that is I own it. Yes, this is my interpretation. My job as a scholar doing qualitative research is to provide you with the evidence that supports the argument that I'm making. And I have to convince you that my interpretation is one that is valuable and useful and valid. But it's not the only one, and that's kind of the cool thing. As a qualitative scholar, it's just one. Different people would watch this show; they would see different things, right? So, I have the one paper that looks at midwifery on primetime television. That was one of my older ones. It was fun. I love that paper. Craziness, Controlling Bitches, and Ultimate Capitulation. That one was cool. Dharma and Greg Gilmore, Girls and Girlfriends. But then more recently, and I say more recently, it was pre-pandemic, co-authored a paper on intersex representations on TV shows like House and Grey's Anatomy, and there were a few others that were in there. It's just one interpretation. So I know that I'm biased.
And owning that bias frees you to help enact the change in the world that will help us all move past certain barriers in health communication.
Based on what you're looking at, Ryan, there's one paper that I really like and co-authored with Dr. Khan, Shamshad Khan, and we were talking about being critical cultural scholars. Ultimately, we know that we are working against the disempowerment of marginalized groups. I mean, we actively own that. And so when you're working in a discipline and with colleagues that are medical professionals or public health professionals, and, they tend to want the quantitative, they don't want bias. Bias is seen as a bad thing. And, we talk about how to address that, how to address the question of bias. And part of it is owning it. But part of it is being clear about what the implications of that bias are so that, it's out there and you can make your own choices.
I'm reminded of how some doctors thought that there were differences in the ways that people might respond to pain based on race, right? Like, and the intersectionality happening there too of that bias, and how hard that must be to overcome. Even in today's age where we have, the information and the facts are available, even though there's misinformation, you can find the truth if you're looking hard and you have the right critical thinking skills to find it. And yet we still have these kinds of old beliefs that have to be overcome.
Yes. And by the way, that is still a belief that has an effect on, I was looking at something that was talking about pregnant Black women and the assumption that they can withstand pain in ways that, so it's still a common.
Which is like, doesn't that just make you want to just, right? Like it's so frustrating to hear that those sorts of norms persist, or those sorts of attitudes persist.
I'll tell you what, Ryan, here, and here's kind of the bottom line for me. I would say one of the beautiful things about my job is, I teach introduction to health communication to students who are going to go on to a number of different professions. Some of them, because a lot of our medical humanities students take that class, right? And so some of them are going to go on to become physicians themselves and nurses and technicians and dentists and, that type of thing. And then some of them are going to go on to do not health related things, but they're going to address health. Everybody does. It's why I love health communication because I don't care what you're getting your major in. I guarantee you have a health experience. You can relate to what I'm talking about, right? So for me, the thing that I love the most is that I can reach them before they become physicians and maybe, chip away at that just a little bit. You know what I mean? Just a little bit so that they go in and pay attention in a way that they might not have had they, not taken this class in health communication and been introduced to this critical perspective.
Health communication and health campaign communication affects every aspect of our lives today. There's no one who doesn't have interaction with the health system. What's some advice you have for your younger self based on what you know now as a health communication researcher?
Oh, as a health communication researcher, well, again, let me remind you, Ryan, that I had never intended to go in and do research. That was not part of my plan at all. And so if I had to give myself advice, my younger self advice, it would be to attend a little bit better, to be more critical thinking about what the implications are of the choices. Now, having said that, it's good advice. Maybe what I should say is I wouldn't give my younger self that advice, because if I had thought too hard about it, I might not have done what I did, right? Go get a PhD as a single mom. That sounds a little ridiculous, right? It's what I would tell my children, is that they need to be critical. They need to be thinking about what the implications are. And if this is, what will make their world and other people's world a better place, right? Not just kind of go mindlessly into to making these choices that you have for your life. So again, my younger self, I I basically I got lucky. You know what I mean? Did you ever see read the books, A Series of Unfortunate Events? Right? Mine was not a series of unfortunate events. Mine was happy accidents that, led me to the perfect place in my world. And so I don't know that I would want to go back and change those, but I would want other youngsters to be mindful.
Absolutely. And what is something that people can do now? What's an action that they can take to heighten their health communication IQ or be more critical consumers of health communication media messages in our media?
Yeah, you just said the right word, critical, right? Don't take things at face value. I talk to my students all the time about, actually watching news at various news sources, right? Not just one, and reading different kinds of news that, they tell me now that they get a lot of their news off of, Instagram and that type of thing. Just get little tiny pieces. They're not getting the whole story. But I think that's really hard to do. I mean, it wasn't until, God, when did I start listening to NPR in the car? Maybe 10 years ago. And then I was like, dang, I'm old now. I'm listening to NPR, though I switched to the other music and get a little bit of my Taylor Swift fix in there. But that would be what I would tell them, is to really think about, what's going on, be critical of the stories that you hear, the news that you read, whatever the doctor's telling you, whatever you're telling people, right? To engage in some introspection. I think and I think that works, Ryan. I don't care which class you're taking, right? In every class is to question everything and to look for more information to back up what you say and what people are telling you.
I remember we were having a conversation, and I don't know how long I had known you at this point, but we were having a conversation. I used the colloquialism, I said something like, yeah, kill two birds with one stone. And you quipped, oh, what did those birds ever do to you? And I was like, oh, that's such a smart thing to say to that old thing, because our language does impact and reflect our reality. And why was I using a metaphor of violence for something that needed no violence? And as someone who, teaches nonviolent communication and loves that body of research, I felt very called out that I had used this kill two birds with one stone. But I also was very appreciative for your ear and that critical ear of saying, wait a second, why are we using that kind of language? So thank you for that. I appreciate that.
Let me tell you something. Do you know what we use instead? And my family uses this. Like we picked up on that many years ago. So now what we say is feed two birds with one seed. And then, yep, right. And then somebody will go like, can you really feed two birds with one seed with that little tiny seed? And I go, check out an avocado, right? So it's just find the right seed, to feed the two birds. So, and we really do. That's one of the things that we say.
And that's a beautiful metaphor for what we're talking about. It happens to be, right? Because from these seeds, like an avocado, we can create abundance, right? And from the seeds of knowledge about health communication and campaign research, from just a little bit of seed, we can fight the misinformation that can do real harm, shorten lives, right? So we can extend life expectancy if we pay attention to our seeds, right?
I think so.
Where can people find you online, Kim?
Well, obviously I have, I'm at UTSA on our website. You can find my link there. My email is there. I have a LinkedIn, though I don't use it as much as I probably should. I use it mostly with my students. And if you want to read anything that I've written, you can Google, just Google Kimberly Kline, Kimberly N. Kline, and you will find the research that I've written.
So we can find these articles that we were talking about, and articles maybe we haven't even discussed, by just Googling Kimberly and Kline and find that research and then be able to apply it to make our lives better, right? Dr. Kline, thank you so much for joining us. We're super appreciative of you taking the time to share your wisdom about health communication.
Well, Ryan, thank you for having me. It's been a lot of fun. I always enjoy talking to you.